I don't even know where.
Yeah.
Just living, recovering.
Like, I don't even know what's supposed to happen right now.
Say it again.
Yeah.
This is G.
So I brought some of these just,
And then if anybody hangs out afterwards.
yeah, okay. That's what I was a little confused about. All kinds of stuff.
Yeah.
Confusion is my.
Yeah, and I even
I
think
know.
of that would just say.
I see you on the July.
Nice to meet you, Dr. Chelsea.
Nice to meet you.
And I was like, well, what is?
Face to face.
Yeah.
Hey, Mike,
Talking.
I figured I would say hi in person too. Hey, Mike, Todd Schneider. Good to say you.
Absolutely. Outstanding.
But our focus is
I much prefer face to face than,
Been virtual the whole time, right?
absolutely.
No.
Yeah, it's,
Better dialogue.
it's a great, especially these days.
Except for when you need the convenience of
That's- yeah.
virtual.
This is true.
Exactly.
When I see you face to face, I know if you're with me or not.
Right. Are you present?
Are you- Yeah, exactly.
Funding and messaging and all that stuff. Yeah.
Is that you all the time or is that the sheriff in you?
He suggested.
What do you mean?
I mean, are you always, yeah, I mean, that's kind of how you
Down your message.
approach. Like, I want to, I like things in person.
Yeah, that's definitely the sheriff's approach too.
Yeah.
He prefers that.
They were
It's just-
saying.
yeah, but that's just, I'm old school.
Yeah, you might say.
I'm adapting and overcoming, but I'm a little slow on it.
Yes, yes. I'm with you, man. I'm kind of old school too. I call people and they're like, you could have sent an email.
Hey, if you have Teams, just message me.
What if we talk it out for a minute?
That's exactly what.
And have a real understanding.
It's terrible thing to say to people.
God forbid I hit my caps and you think I'm yelling.
Right?
What was wrong with Todd? He was yelling. Caps, didn't notice.
Talking to my sister, but she brought it. With, trying to,
Shouldn't have done
make
it.
it browser about what is bothering us
Yeah.
this morning.
An attended QR every morning.
Yeah, every morning.
There's the dogs were so mad today that
Yeah,
I.
there is.
And I had to come here yesterday too. So they got mad at me yesterday.
But you can't do that virtually.
I go, they won't get out of bed. I told them I had to go out.
I mean, seriously,
I know.
that was
They're
like
so mad.
putting everybody.
Because they're so used to us.
Yeah.
Yeah.
Yeah. He goes through.
Yeah.
I won't move. I told him to get up. They wouldn't. I go, massage.
My sister and my
Yeah.
niece
Oh, okay.
up
I'm
in
like, sorry.
both. Well, County.
And my sister's a horse massage person.
Oh, really?
I'm so happy I was coming here.
Where's she at?
She's in Fort
Marking up my
Collins.
ID.
She probably knows them. I mean, they're all over. the
No,
horse
she
shows
does
and stuff.
like shows and competitions.
No, it's
My
when I
sister
came here last
teaches
week
kids.
and I put my badge.
It's like training
put my
horses.
badge, And then I couldn't find it
And more
yesterday.
than-
And I'm like, oh, just start where I thought it would be in my laptop bag. But I couldn't find it.
My niece's husband is.
So I phoned it like a shoe the other day. So.
Yeah.
Of course, business, for family.
Yeah,
Yeah.
family, as they say.
It's not in the habit of it.
Hey,
Hello, how are you?
good.
I'm Patrick.
Patrick, hi, Linda.
Linda, good to meet you.
Where are you from?
I'm from Lutheran Hospital. And do the patient navigation and things.
Which hospital?
Lutheran.
Oh,
the
Lutheran.
The
new
new
one.
off 70.
Yes,
From the neighborhood in Wheat Ridge.
yeah, I haven't been in the new one yet, but I was in the old one plenty of times. So,
It is nice. Yeah, we got lots of things. Should make.
so you're finding it to be true, that to be true, because I know a patient who went there and says, God, it was totally overwhelming, but of course it was their first time.
Oh, sure.
building, and-
It is an overwhelming building. I still walk around, so like I'm a specialized case manager that goes everywhere in the hospital. So I'm pretty much left to find my way. So I just walk around like I know where I'm going. That's the key.
Yeah,
Sure.
that's a good idea.
I know, right?
My badge gets me here. I am allowed to be here. I'll figure it out.
He works at Lutheran Hospital, he's just talking about.
Oh, I know.
No,
Yeah.
It's a big maze.
Never.
Figuring it out slowly.
Citizen.
No, it's not too bad. No, it's pretty
Yeah,
neat out.
pretty.
I have to find all the nooks and crannies.
I think like he's been.
So people get their departments and then you'll realize.
You know.
I do have a QR code up top for people to check in. Feel free to do that. We'll give it a couple minutes. We are expecting about 30 people.
That's good.
Yeah, I know. I was really impressed. I got at least 20 RSVPs on all 3 listening sessions in a little under a month. I was like, yeah.
Yeah, you know what? Because I looked at it this morning, where the bottom part says, see who's coming. There was only like 3 names and I thought, oh geez.
You have to click expand.
Oh,
I know, it took me a while to figure that out. I got really nervous that there was only 3 people.
I got
When
nervous for it.
expanded, there's so many more.
3 people, that's not good enough.
So when I asked you what meeting you're going to, if you scroll all the way down to the bottom, there is a Jeffco listening session. This TV is supposed to be on. We are supposed to have catering. They are running a little bit late, so there will eventually be coffees and pastries available.
It's 83 or something.
Oh, yeah. It's the same.
What's today?
Good morning.
Talked to him 10 years.
Did you say scroll down?
Yeah, scroll all the way to the bottom when I asked you what meeting you're attending. And there's one that says Jeffco listening
Oh,
for.
my gotcha, sorry. I did not listen.
It's okay.
Thank you. Thank you, I appreciate it.
I'm glad you're here. Especially this time period.
Statement that you put out.
Oh, what is the purpose of, like, what are they doing?
Oh,
This particular.
Appreciate
you
the
know,
question. Going and then they would ask them. Statement.
It's really sound.
We wasn't seeing anything.
Chelsea, are we allowed to ask what company we use?
That's Monday.com.
No.
Oh, yeah.
This one guy,
Like,
Well, only because I had a catering company for a long time. I'm always curious.
did it, send it to him. He sends back to me, says, is this something I'm supposed to do? I'm like, no, it's facts. So then his computer starts to look up to me.
Yeah.
So it's just really.
He's the only one.
Too, because for me, I really enjoy it changes the nature of complicated. You know, it's just really nice. I don't need 1 others that we have that voters approve.
Yeah, I can. Change my password.
Hello.
So hopefully
There are
it's.
only 2 categories of
Fixed.
existence, right? Still.
Okay.
Yeah.
All right, good morning, everyone. It is 2 past, so in the interest of time, I will go ahead and get started while people trickle. My name is Dr. Chelsea. I serve as the program manager for Gateway to the Rockies Regional Opioid Council. We are the Region 10 Council specifically. I do have an attendance QR code up there if you don't mind checking in. When it asks what meeting you're attending, please just scroll all the way down to the bottom. Since we do have not as many people as I was anticipating, let's just go around the room and give some brief introductions, and I'll start over here.
Great. Good morning, everyone. It's good to see you. I'm Jefferson County Commissioner Leslie Dahlkemper. I'm one of your 3 county commissioners, along with Rachel Zenzinger and Andy Kerr. And I have the honor of also chairing the Gateway to the Rockies Opioid Council. And we have a tremendous team. We're so grateful for Dr. Chelsea's leadership as our project manager of this initiative. We know we have real challenges in terms of the opioid epidemic, but we feel so grounded and positive in terms of all of us coming together. Your interest, your being here to share more about the work you're interested in doing and how we make sure we get these dollars into the hands of our community and help the people who need it most. So thank you so much for being here. We really appreciate your taking the time. It's nice to see some familiar faces and meet some new folks as well. Thanks.
Good morning. My name is Sasha Hutchings. I use she, her pronouns, and I'm the Executive Director of Jefferson County Communities That Care. We are a countywide coalition, youth-centered. Our mission is to work in partnership with youth to improve health, safety, and wellness in Jefferson County. So we're focused on prevention.
My name is Allie Holton. I'm the Development Associate at Savio House. We focus on building family relationships to build resilient communities. We are a mental and behavioral health nonprofit, and we are hoping to open in the next year the first residential facility in Colorado that will keep the whole family together. So I'm excited to hear more about this program and this work and to be here this morning.
Hi, I'm Julianne Rist. I'm the Library Planning and Senior Advisor for Library Planning and Policy. Sorry, it's a new title, 2 weeks. I'm also on the county's opioid task force, so I'm here to listen so we can hear about needs and other pieces that are going on in the county and figure out how we can help support some of those.
Hello, everyone. I'm Patrick Minahan, a licensed professional counselor and recovery patient navigator over at Lutheran Hospital. I work as a bit of a pilot program through Signal and Daniels Fund as kind of an assertive case manager outreach for anyone flagged with any substance use concerns. Also part of the advisory board for the council and here to listen to all the great projects. Thank you, guys.
Hi there, I'm Kelly Barker. I'm currently a grants consultant with Recovery Works, which is based out of Lakewood, and they provide access to recovery resources and community for unhoused neighbors. So I'm happy to be here.
Hi, I'm Linda Behringer. I'm with Just Living Recovery in Lakewood. And we are a sober living facility that focuses on the peer run opportunities for people, particularly in the LGBTQ and BIPOC community. More in Lakewood. I think I may have said that twice, but.
Hi, I'm Dave Blair. I'm with the Denver Family Therapy Center, and we're a private business. Been in Wheat Ridge now for how many years? Since like 92. So we've been around a while. We're do both outpatient. Well, right now we're doing outpatient mental health and substance abuse work. We've been involved with the substance use field for quite some time. We ran the prevention program for the county for Jeffco, the YDAP thing, if anybody remembers YDAP. And we did that for 10 years. We've had an intensive outpatient adolescent substance use program. We did that for many years. And that we recently let that go, but we're just focusing on outpatient stuff, both adolescents and adults. And we're added some nurse practitioners to our practice and that sort of thing. So we want to, we are excited about the possibility of that that services as part of our continuum of care that we've got going over there. So that's us for now.
I'm Jamie Blair at Cheveria, and I'm also at Denver Family Therapy Center. Dave is my dad, and so we have a family business. You already showed everything about Denver Family.
I'm Todd Schneider. I'm with Jefferson County Human Services with Children, Youth, Family, and Adult Protection. I also chair the Jefferson County Opioid Task Force and here to, listen, learn, and be part of. So I'm really pleased with the opportunity to be around and with everybody here.
Thanks, Todd. So I'm Tina Wise. I work for Human Resources and Total Rewards, overseeing employee benefits, wellness, and comp and class. And I am also chair of the Opioid Task Force, and we're here today to get some input from all of you so that as a group, we can bring things forward to the Board of County Commissioners that are strategic and provide some recommendations on how to use Jefferson County's funds for the settlement.
Yes, so in the e-bite from 10 to 11, we'll be talking about the regional council. And then I will break down kind of how the pots of money are organized, but from 11 to 11:30, the Jefferson Task Force will talk about their specific work.
Thank you. My name is Marty Ferrero. I'm the Executive Director for Spiro Recovery Center, which is located in Evergreen. We're a not-for-profit residential program, 30 to 90 days. We also have a clinical space in Evergreen, or Evergreen Parkway, I should say, separate space for our intensive outpatient program and recovery groups that are facilitated by peer certified recovery specialists. And we just, I've been in this biz for almost 29 years. I've been in recovery for 32. I can't count anymore the number of patients, clients, friends, acquaintances in the program, family members, that have directly lost their lives as a direct result of this disease. I know I'm preaching to the choir here, but just found out yesterday, yet another former client who was with us for 3 months, went to sober living, and then just yesterday found out that he was found, overdosed. And this is on the heels of another one like a month ago. And I spent the majority of my career at Hazel and Betty Ford, also care in treatment centers in Pennsylvania, two of the oldest not-for-profits. I've only been here since mid-June, but so I worked in these big systems and lots of teams that do all these things, and now I'm small. I love it here, but I've never written a grant, and we're in the process of applying, and I know all these funds are coming and available, excuse me, and it's like, well, how do we get a piece of the pie to help people even more than we already do, because we're doing everything we can, but man, this is especially with fentanyl, it's just Russian roulette, and it doesn't take much, and when people have no tolerance after being sober for a few months, boom, that's all it takes, and most of them didn't want to die, most all of them didn't want to die, and here we are. It's really tragic. I'm glad to be here and look forward to learning more this morning. Thank you.
Mike Brang, I'm a commander with Jefferson County Sheriff's Office. I'm over research, planning, development. I'm here to be able to provide a first responder perspective on things from medical, fire, and law enforcement. We also have several programs that we are participating in, or actually have within the detention facility to help with substance abuse, but also with transition from custody back to being in custody. So I appreciate the ability to be here and participate. So thank you.
Hello, good morning, everyone. Sorry, I was a few minutes late. My name's Heidi. I am the CEO of I Am Recovery Sober Living, but also here on behalf of New Beginnings Recovery Center and Mary's Hope Sober Living, where I have recently kind of linked up to help them expand and oversee operations, quality control, a variety of things there. So just kind of the full continuum of care, from inpatient residential treatment, outpatient services, peer supported services, and then all the way through sober living. And I think we're looking at developing out a TRT program and a few other things right now. So it's kind of exciting stuff to be in the mix of right now. And originally when I was looking at this funding, I was like, I don't, I wasn't seeing a clear path through. And then now that I'm kind of joining with, this other organization that's been doing this work for a long time, like I'm seeing a pretty clear path through like how we can really support people in addiction recovery and what that's going to look like. So yeah, excited to be here. Thank you.
Kate Newman, I'm the Deputy County Manager here at Jeffco. I provide overall support to staff that's working on this program and commissioners that are working on this program. So I'm just happy to help support this program.
Me?
Yep.
All right. Sean Henley, I'm sorry I was a couple minutes late as well. But I am the co-founder and administrator at Red Rock Recovery Center. We're a full continuum of care, substance use disorder treatment center. We operate right down the street here, been here for about a little over 10 years now. And over the years, definitely have been really front lines of this kind of battle we're all in, and just constantly looking for ways to innovate and collaborate to better solve the problem, because sometimes it can be discouraging. Feels like just doing barely putting a scratch in it, but it's really been inspiring being involved with the council for the last several months and getting to work with Dr. Shore. Just seeing how many people are coming to the table to try to help solve this problem. I'm also recently gotten the honor to be an advisory member on the council as well to help with the reviewing applications. So excited for that.
All right. So I will actually be going through a name change in May. I'm getting married. So I will be Shore Miller. So just to kind of help with that confusion, I do go by Dr. Chelsea. Kota is my service animal, so sometimes you will see him with me. I did share my recovery story at the November meeting, so that is recorded in our archives. But I am actually a product of the opioid settlement. So I was given an open-ended script of opioids when I was 15, spent 10 years in active addiction. I do describe my recovery as sober, not necessarily abstinence. I'm working on 11 years. I don't really like to count. But yeah, so I'm super excited. This is a very full circle moment for me. I joined the council in October. I do have a brief agenda. I am going to talk about the National Opioid Settlement, specifically the Region 10 Council, the advisory board and opportunities to get involved, our 2024 grantees, which were the first round of funded projects, our 2025-2027 strategic plan, which will lead us into the currently open request for applications, or RFA. Then I will talk a little bit about how we plan to evaluate our work as a council and be transparent with the community. And then that will lead us into a community discussion for you to identify gaps, resources, network in the room, and really help us guide that RFA evaluation plan. So the National Opioid Settlement comes from a series of lawsuits against the manufacturers and pharmaceutical companies of opioids. So it's something in the ballpark of $40 billion over the next 18 years. It's not a lump sum, so it's rolling money. Our council, our regional council specifically, is looking at around 30 million over the next 18 years. But funding is designed to be adaptable, multi-pronged, to both combat immediate effects of the opioid crisis and prevent future harm. So the Attorney General's office likes to use the word co-contributing disorders or co-contributing factors. So that would be things like low socioeconomic status, housing insecurity, family history of trauma. So it's not necessarily that funding has to go directly to opioid. If you were in the ballpark of that co-contributing, that would still be a great use of funds. So again, we are not federal dollars. So with these federal budget cuts and executive orders coming up, we are not federal dollars. We are settlement agreements. So there are some federal and state grants available through the opioid settlement. That is a different pot of money. I do encourage braiding or blending of money. We just can't duplicate line items. So my salary is paid by the regional council. I cannot go apply for a grant to get a second salary and make $200,000, which would be great, but not allowed. So the goals of funding again are to abate or make right and prevent, and then support for recovery. So anything in that ballpark of prevention, education, recovery ally training, family support systems, all appropriate. I want to be cautious with this word with new executive orders, but it is a word near and dear to my heart, is equity and need-based distribution. Another way of thinking of this is accessibility. So there are vulnerable populations. It's not just people of color. It is also white males who live in rural areas are at high need. They are at high risk. And so that is a population of interest. So really think broadly when you think about equity and needs-based. Again, I don't think I have to talk about that to most of those people in the room, but I am recording this, so if people do watch online, they understand. And then again, there's county, city, and state level fundings. There's county, city, and state level agreements around funding. Those are all different pots of money. So it does look something like this, is like federal money, state money, region money, that's the GROC. County local money, that would be the Jefferson County Task Force. Some cities have also kept money. They can opt out of keeping their money and donate it to the regional pot because dollars will go further when you combine dollars. So sometimes, for instance, we have our 2025-2026 or 25-27 strategic plan. We've allocated those funds, but we got a $6,000 payment yesterday because someone decided not to keep their money. So we have an additional $6,000 that we get to award out. So that's happening all the time. Again, the money is very fluid. So spending categories are very broadly prevention, treatment, recovery, harm reduction, and then there's law enforcement, public safety. It's also referred to as workforce development or planning and coordination. So this would also have to do with like hiring and training clinicians, designing internship pathways for students in MSW programs, to do a clinical internship in substance use disorder recovery in an area of need, and then retain them in that area so that they don't do the internship and then move off. Right, a lot of people don't want to go into, a lot of students, Gen Zs, don't want to go into community health because they can make more money in private practice, but where the people who need the most need in community health. So how can we increase those stipends and increase that retention in the workforce there? Oversight and accountability, so regional or state councils. So regional councils are referred to as ROACs, Regional Opioid Abatement Council, often oversee the distribution of funds, ensuring they're used effectively and equitably. They set guidelines and monitor outcomes to ensure funds make a measurable difference. This is important because not all programs are the same, so not all variables of measurement are the same. Impact looks different based on the program that you have. Something I love so much about the GROC Council is that they really are community-based, not community-placed. So they want to guide what variables they would like to see you collect and complete, but they're not prescriptive. If you don't have the capacity, or if there's some HIPAA, in school it's FERPA violation, or if you're working with minors and you can't collect some of that more sensitive information, we understand that's not going to disqualify you from funds. That's not going to dock you in your quarterly report. We, again, are only in our second round of funding. The council is in its third year of existence, so very much in its infancy. We are working on a data dashboard to provide transparent information and metrics of data to the public. How much money is coming in, how much money has gone out, how much money is allocated to go out, and when, and then what is the impact of those dollars? How many people are being served? What are those demographic characteristics of people being served? Are we really targeting need? Not just looking at recidivism and relapse, but also looking at recovery capital. That's one of my favorite metrics. So how can we look at recovery in different ways? Remember I said, I'm in recovery, I'm sober, I'm not abstinent. So by a lot of metrics, I would be counted as a relapse, but I'm not. I'm actually thriving in my life right now. So how do we just define recovery differently and look at all of those possible variables? So challenges and considerations, ensuring long-term impact, community needs assessment, and addressing stigma. So really, what are the needs of the community? Just because a community does not have a treatment center does not mean they need a treatment center, or that they even want a treatment center, or that that would be a financially effective investment to build a treatment center. So how can we invest in other things like transportation programs to capitalize on existing programs? I'm all about networks theory and systems theory. And then again, just addressing stigma. A lot of people don't want to say that they're in recovery, but this is, again, the largest part of my identity that I found a lot of power in. So how can we reshape that narrative? I'm also a Mac user, folks. I've had so much trouble adjusting to this HP. Again, so here's kind of like a breakdown. There is a QR code, and then this PowerPoint will be posted to the YouTube channel with the video, so you can go into those direct links. But you can learn about the 19 regional councils. It is imperative that money stays within the region. So if you are a Denver-based community and you provide services in Jefferson County and in Denver County, the GROC can only fund the Jefferson County portion of your organization. I cannot fund the Denver portion. You would have to go to the Denver Regional Council to apply for their funds. Every council has an entirely different process of applying. They all have different windows. They all have different evaluation metrics. I understand it's very confusing, but please check out their websites. So again, GROC is at 60% government share. And then the local government share, this would be your Jefferson County task force. Gilpin County and Clear Creek County do not have specific task force at this time. The GROC has a 16-member structure, so quorum, or in order for us to solidify any type of decision, would need 9 voting members. It's comprised of 1 rotating city representative per county, so 3 total. They serve a 2-year term. 1 county commissioner per county. There is no term limit. 1 law enforcement representative per county. They also serve a 2-year term limit. 1 municipal or county court system. This has to be agreed upon by all 3 counties represented in Region 10, but it is 1 individual. 1 human services rep per county, again, serving, so 3 total, no term rep. And then 1 public health representative per county, 3 total, no term rep. So this is our current roster of members, their title, specifically what category they're in, what county they serve, when their limit is up, and then who their alternative is. And so if Dr. Tim Ryan was unable to attend a meeting, his delegate is Emily Cooper. She would vote in his place. And this is also on our website for if you would like to dig into that more. We do have an executive committee, and this is where they like to get in the weeds, have more of those in-depth conversations that we don't have time for in that monthly 2-hour meeting. They don't have delegation at this time for a lot of things. It is more just strategic planning and direction, in-depth discussion. So if someone were to request a letter of support, that request would be brought to the executive committee for an in-depth discussion. If the executive committee decided to support that letter, it would then go to a full council meeting. There would be a brief overview presentation of the letter. There would be a group discussion. There would be a strong recommendation from the executive committee. Then there would be a vote that would either provide the letter of support or not. So this is our current executive committee. All meetings are open to the public, so you can attend both open and executive meetings at any time. The people at the top, Chris, myself, Jean, and Eric, we are administrative support. Jean and Eric are specifically legal advice. Chris Habgood is our fiscal contact, and then I serve as the program manager. We are non-voting members. So we do have a general meeting schedule. If you click that QR code, it will take you to our website, specifically the work page, where it has all of our meetings linked to they're hybrid at this time. So all of the meetings have a virtual link you can click on. I also highly encourage you to subscribe to the public Google Calendar, because then you'll get calendar invites. I drop the agendas in there, the meeting links are in there. That is the most in real-time way to connect with the council. But right now, generally, council meetings are the fourth Monday of the month from 1 to 3 in this room. Executive committee meetings are the first Monday of the month from 1 to 2:30. Those are entirely virtual. There are some like in May, like I said, I'm getting married. So that meeting is going to be on May 12th. It won't be at the end of May. And then in December, I think November and December, they're the second Monday of the month just because of the holidays schedule. So these are some resources. We do have a website. I'm updating it almost daily, and we are going to be migrating to a Civic Plus website. So it just has more features, a calendar option, notification options for people to be involved. We do have a YouTube channel, so please subscribe. All meetings are posted there. I've done webinars for our application window. All of those are posted to the YouTube channel for you to watch. Again, the public Google Calendar, our public Google Drive that has all of our documents in it, our minutes, agendas, worksheets, any other like materials that have been supplied during meetings can all be found there. And then this is my email. Feel free to reach out. I am your point of contact. I love engaging with you all and learning about your programs. Some guiding principles for decision-making. Spend money to save lives. Do not sit on money. And then use evidence to guide spending. So in these RFA reviews and brainstorming sessions, I've got a lot of requests for experimental programs. So again, the council is in its infancy and it is not looking for progressive, innovative, or high-risk programs. It's looking for safe, proven to be true programs. So you might be combining things that are evidence-based, like MAT, peer recovery coaching, clinical mental health services, but the model itself has no evidence of being effective. And so that is kind of a risk. So when you're thinking about your budget, think about, again, that risk versus individual services. Invest in youth prevention. This is great. That 18 to 24 age range has my heart. But it is youth prevention, destigmatizing, talking about substance use, about alcoholism, and about recovery and different pathways into, for, and of recovery. Focus on racial equity. Again, this is not just racial equity for Region 10. This is all types of vulnerable populations, veteran status, single parent status, rural community status. All of Gilpin, Clear Creek, and the majority of Jefferson County are considered rural areas. Housing insecurities. So gender and sexual identity. So again, think very broadly about equity. Develop fair and transparent processes for funding recommendations. So we did just approve our standard operating procedures manual, the first draft, at our last meeting. And this is a public document, but it does explain what our processes are and what our evaluations are, so that, again, we are being transparent with the community. If you have input, please let us know. This will be the first time we are using this specific mechanism, the RFA, in this specific way. So we do expect some hiccups, but we are always open to feedback. After you submit your RFA application, you will be directed to a survey that goes to me. Again, I'm not a voting member. I probably will not look at them until June, but I really would like your feedback on what was confusing, what was not clear, what you enjoyed, what you didn't enjoy, how that process could be improved, and more importantly, how capacity building for that process can be improved. And then consider future sustainability in all recommendations. So this is, again, there was only 1 year funding, but that, having been on the ground, like, that's not very sustainable. And it creates more anxiety than you get to actually use that year. So we are allowing 2 years of funding, keeping in mind those requests can go for 2 years, keeping in mind that if you are not meeting your deliverables, the council does have the option to cancel the contract at any time. So there will be learning forums to grantees. So hopefully we never get to that point. There'll be a lot of capacity building and education and training, open communication. So hopefully we never get to that point. But that is something that the council is considering in terms of sustainability, is letting your dollars go a little bit further. All right, so the advisory board to the GROC. There are two types of advisory board members, discretionary and non-discretionary. Discretionary members are appointed 2-year terms with no term limits. Non-discretionary are unlimited and self-enrolled. The GROC also includes current grantees as advisory members. Advisory board members do not currently have duties or ad hoc meetings. They're just community voices per required by the intergovernmental agreement. We do hope to change this and make the advisory board more robust with ad hoc meetings and more specific duties. The first of that was the opportunity to review applications for funding. So all of those names did have to be approved at the January meeting because those individuals will go through trainings to review the applications in non-biased ways. And then they do have to sign non-disclosure agreements. So kind of just breaking this down a little bit more, I will not read you this whole slide. So non-voting members shall be appointed by voting members. And then reasonable efforts to avoid appointing providers who receive or may receive opioid funds as non-voting members. Some non-discretionary voting members and some, oh no, I lost my point. Discretionary, it's discretionary, non-discretionary. So again, the discretionary members, they're non-voting, but they have a voice. They have to be nominated and confirmed. And then they serve a 2-year term. So this would be approaching anyone. I don't know if I can nominate people. I don't think I can nominate people. I think it has to be a voting member. But if you are interested, then you can approach me or you can approach your county rep. We do have an About Me tab on our website, so you can figure out the voting member who you would work closely with and talk to them about nominating you to be an advisory board member. The whole council votes on that. You serve a 2-year term. Non-discretionary has no term limit, and these are just given out to people who want them, specifically school districts and fire districts. It was fire districts of 25,000 or greater, but we just invited all fire districts in Jefferson, Clear Creek, and Gilpin County, and then school districts of any size. So anyone who is part of the school board or a school professional in substance use healthcare, they are just granted an advisory board member position. So that's just a matter of telling me and I put your name down. And they have no term limit. So I'm starting to track like what that looks like in terms of discretionary, non-discretionary. So as you can see, we have a lot of blanks. And people that need to be updated. So if you fill one of those spots, please let me know. And again, these are not prescription, they're just a guide, and it's not limited to one person per area. You can have there's no cap. All right. So these are the 2023-2024 grantees. Let me see if I can move myself. There is again, a QR code here that will take you to the landing page with more specific information about the grantees. They also submit quarterly reports, and then I summarize those reports and post that to that grantee website. So again, just trying to be transparent and metrics, how money is being used and to what degree. So Gilpin Sheriff, the CCHAT, Clear Creek co-responder program, and then JCMH, specifically the Wheat Ridge Police Department, were all approved for co-responder programs. I do have the corresponding amounts right there. And then Advocates for Recovery Colorado was approved for a larger amount to serve all 3 counties. So specifically hire a program manager in each county to host programming in the county, a regional manager to do more of the grant management, reporting and attending meetings. So they are getting off the ground. The total amount is listed right there. It's like 1.2 million that went out in the first round. All right, that brings us into our 2025-2027 strategic plan. Which looks something like this. Again, this is posted on our website. So if you've been reviewing that request for applications, that funding page, it's right there. The council decided to do roughly 14% of dollars available into the harm reduction category, 12% into planning and coordination. Again, that would be like that workforce development. A little bit, about 14% to prevention, 31.5% to treatment, and almost 30% to recovery. So it comes out to being roughly $12 million that we have to allocate over the next 2 years. Again, just because we have the money does not mean that we need to spend the money. Yes, spend money to save lives, but also thinking about sustainability and if the programs are the best programs to do that job, the organizations have the capacity to do what they claim they're going to do in their application. Kind of different ways that you can approach the RFA. The first way is go with a safe ask. Let the council get to know you, your organization, your work, build that relationship, then ask for that bigger, more experimental expansion program. Option 2, go big or go home, right? Ask for everything that you need, knowing that the council can partially fund. And so, right, there is some evidence to say that like, I need $8 million to do this, but if you give me 4 million, I can scale that. And so they're like, okay, well, we're gonna give you 4 million, build our relationship. Let's see how you do it doing this. And then we'll give you more money to continue the work later. Different approaches, no right or wrong way. Again, the council is still in its infancy, so there's not a lot of politics to be privy to on how people think or vote in that way. It gets broken down more like this, and this list is not all inclusive. So in the funding announcement and on the website, you can look up Exhibit E approved uses, and it will give you a full list of approved uses. Anything aligned with Exhibit E is an appropriate application in this round of funding. However, if it meets this strategic plan, that will be given priority because this is what community input has guided the council to say are the areas of most need. We might not get applications in this round for this area, and so that would default to a really good application in an approved use Exhibit E funding area that maybe did not meet the strategic plan. We have allocated 2% of funding to admin, and so that would be for like my stipend, the Jeffco IT team that's helping build out our website, any type of like things that we do in administrative, our legal salaries or their stipends, that goes to them. We do have a 3% contingency fund, and we do follow an NIH National Institute of Health approach for awarding the contingency fund. This will not be open during the RFA process. It will only be open when the RFA process closes, and it is really designed to be an emergency. So let's say Narcan money is running out and we have a surge in overdoses and we need Narcan, that would be an emergency use of funds, and the council can approve that. And then again, my salary is right there. And then program evaluation. So we are looking to have a solicitation for an external evaluator open in June, July with review in August. So that we can again have that external accountability and transparency. Our RFA process looks something like this. So develop timeline and scope, create the contents, develop the application and post it in Civic Plus. I manage the communication. We close the application at midnight on March 31st. The fiscal contact and I will sort through those applications for completeness and organize a matrix of review and discussion. Then they will go out in first round scoring asynchronously. Every application will be reviewed a minimum of 4 times, once by a voting member in Jefferson, Clear Creek, Gilpin, and then an advisory board member. Those scores will be averaged together and then applications will be ranked, looking for a natural break. Those above the natural break, ideally it would be a score of 91 because that's a satisfactory application, would go to the next round of group discussion. I will be talking more extensively about that process at the meeting next week, so I won't go into that here. But discussion will last about 2 months, and then we'll have 1 month of contracting. Awards are anticipated to be announced June 23rd. I give you that brief overview here. I do give you a brief narrative here, again, of what that would look like. I'm gonna go into this heavily next week. And then again, finally, just like how we evaluate our work. So I'm still working on a baseline evaluation. I did present my preliminary baseline evaluation at the January meeting. That is available for you. I've linked it right here. It's also on our website of just kind of the direction that the council is going, where some gaps are. I'm still in that process of what are our metrics of success, because I've never been through a funding round with the council. And because the first round of grantees did not have post-award support, implementation was a little bit rocky. So hopefully we'll develop some more metrics. But generally is like, what is GROC funding going towards? What are outcomes and goals of each grantee? To what degree are they achieving their outcomes and goals? And then more collectively, of what degree is GROC mitigating the opioid crisis in Region 10? There was also a process evaluation of how well the council is implementing programs, managing funds, and engaging stakeholders. This evaluation focuses more on understanding the operations, decision-making process, and adherence to goals. So that's where that standard operating procedure was built out. All right, so finally, I wanted to leave enough time for discussion. I am tired of talking at you, and I know I threw a lot at you, but there is a QR code for different ways that you can get involved with the council. But I want to just, again, open the floor to thoughts, comments, concerns, I know I threw so much at you folks.
Excuse me, just real quick, to access this PowerPoint, we go where?
It's in the calendar invite in the Google Drive. And then when this recording is done, I'll put it on the YouTube channel and I will link it in there. Yeah. Yes. Oh, if you could say your name, please, when you speak.
Sean Henley. Thank you for all the information and putting this together. That was great. I have a question. You mentioned that that the council doesn't necessarily need to spend all the money that it has to award. I'm curious what you do with funds that are not spent.
It rolls over. Yeah. It rolls over to the next year. So we are looking at having another request for application window open. We're trying to move the funding to more of a calendar year. So contracting would happen like November, December, and then your award would start in January. So we might open an RFA again in September. Yeah. Name.
I'm Kelly, grants consultant with Recovery Works. Was curious if you could shed any light on kind of how the council looks at outcomes impact, like with specificity around, because specifically we work with the unhoused population, and so, you know, our goal is like housing is in tandem with recovery, and if we can't find housing, which is often beyond our control, but like when people exit, then it's hard to track people to ensure they stay sober, things like that. So just curious how the council looks at that, if there's any, or if that's still in development, I'm sure, but.
Yeah, again, it will be, maybe Commissioner Dahlkemper would like to speak to that a little bit more, but the council is community-based, not community-placed. So again, the impact measurements that you use would be dependent on your specific program, more specifically on your application. So an application to fund housing scholarships would look different than an application to solely fund a case manager to find housing. The outcomes of both of those would be different.
And I would just add, I agree completely. And you heard Chelsea talk a little bit earlier about the evaluation component, and we're really digging into what that looks like. Because, we want to ensure that we're transparent and we're accountable with the funding. So we can measure what sort of impact we're seeing, but we also recognize that sometimes there's a lot of gray area around that too. So we also need your good thinking as we look at that evaluation process moving forward.
Yeah, so again, like impact for housing for you might look different than impact in housing for Todd. Because you guys have different programs with different purposes and different capacities and different networks. So community-based, very fluid.
Hi, I'm Heidi. I have a silly question around that. So I was doing the budget and I'm like, all right, if we're asking for scholarship money, right, to scholarship people into housing, what category does that fall under? Or is this something you want me to email you about?
I do
know there's
go
recovery.
Yeah, I do go over that in the webinars. Yeah, in the webinars, how to categorize. But that would probably, off the top of my head, it would probably be connecting people with services.
Thank you. Okay, that's what I thought it was, but I was like, oh, no.
Yeah, and it's not a break all. So like if you submit an application to treatment, but when I'm looking over your application, I'm like, oh, this kind of I'd rather have this application discussed during the planning and coordination conversation. I'll just go ahead and move your application. And we can shift some dollars around. So if I think in the first round of funding, they allocated most of the money to treatment, but they didn't get any applications for treatment. And they got a lot of applications for recovery. So they were able to reallocate dollars into a different bucket. That's something that's possible. And so again, if your project, I am asking you to submit to one funding area. So you might do treatment and recovery, but the bulk of your application is treatment. Please just submit to the treatment application. Which specific bucket the money comes out of is mine and Chris's problems later. Same thing with capital. If you are asking to purchase a house or acquire land, it doesn't matter if it's treatment. If you're asking for construction costs for a treatment center, it doesn't matter. That is capital. Please submit to the capital bucket. Again, I will move your application if I feel that that is the most appropriate way, because again, we can pull some money from treatment, some money from recovery, some money from planning and coordination to fill your capital fund instead of pulling all of our treatment money for your capital fund. And I have asked people to consider submitting 2 applications. So if you're asking for construction costs and you're asking for scholarships to fund people through treatment, I did suggest 2 separate applications, one capital and then one scholarship, because the capital conversation is completely different. And I don't want your whole application to get caught up in group discussion and not funded because we can't find consensus over do we fund your construction costs or not.
While we're on that conversation, Heidi again, hi. So if we have 2 separate organizations, because there's Mary's Hope and New Beginnings, one is treatment, one is recovery, and we're looking at 2, expanding on 2 different projects, is that going to be 2 separate applications?
My initial response is yes, but I would have more questions.
You and I have a scheduled thing this evening.
Okay.
Talk more then.
What about gaps or issues that you're seeing in your field, anticipated budget cuts in your fields?
Patrick from Lutheran as a recovery navigator. I see, and I love that we delineated a transportation budget. I think it's a secondary concern for a lot of people, but it's the primary concern for most patients. And so I have no idea how they're getting there, how they're getting back. They'd love to go, but yeah, all the challenges and barriers to just getting there. And so, yeah, like a lot of work that I do as an assertive outreach case manager in the community is I'll team up and meet up with people, although legally and liability wise, I can't transport a client myself. Just even that encouragement to be like, I will meet you at the front door and walk in with you, reels people in and gets them encouraged to go. And so just seeing that transportation piece, like all these things are really great if no one can get there. we spend millions of dollars on building great new places, but if we don't spend $20 on a cab ride to get them there, they won't show up. So, yeah, transportation is huge.
I love that efficacy building and problem solving too, is like, you can find a ride, like, this is a problem, you have the capability to solve it, because if you can solve a problem of how do I get a ride, you can solve this bigger problem of how do I overcome addiction.
Sean Henley again, just talking about kind of what we're looking at, what we're kind of concerned about, I think is talks with reductions in federal spending and how that's gonna impact Medicaid. And I was talking with the head of COPA the other day, and she was just talking about there being real concern about eliminating Medicaid expansion and what that would do to funding for a lot of the individuals that enter treatment through, you know, the different region, the different rays and covered by Medicaid. And so, yeah, I mean, it'd be, I don't think it's like the sky is falling yet, but I definitely think it's something that a lot of providers are gonna be faced with a real dilemma. You know, right now, 30 to 40% of our patients come in covered by Medicaid, so just wondering how they would be able to afford treatment should that not be available anymore.
Patrick, again, from Lutheran, piggyback off of that comment, I was in the starting admission side over at West Pines when that shift happened for Colorado Medicaid and all the rays opening up to covering inpatient residential treatment versus not. And it was a horrible position to be in as a young clinician, sitting there answering the phones and having ungodly numbers of people ask for some help and just say, sorry, you have Medicaid, no. And then as far as that assessment and then referral on side of things of trying to ask, then the follow-up question is, where can I go? And to be drawing dead is not a great place to be sitting. And so, yeah, definite fears on that. And if we go back to what was 5-6 years ago, and that is just cut off, we're, yeah, as a state gonna see things go downhill quickly. So, yeah, hopefully we can, can address some of those concerns, get more people into treatment through all the policies and processes.
Dr. Chelsea, I would just add to that, we were talking about this before the meeting started in terms of the very real concern that we all share about the future of federal funding and what it means for all of the services and programs we provide, either as Jefferson County or as a municipality, as a nonprofit, as a hospital, and more. And I know at the federal level, our Colorado congressional delegation is doing everything that it possibly can to fight these proposed cuts. And I was at a town hall yesterday with Senator Bennett and Congresswoman Pedersen and Medicaid, you know, the concern around the issues of healthcare services and what the potential cuts could mean, and just the dizzying amount of executive orders that are coming forward and how do we work through all this. But I do want to provide some hope in that we have very strong leaders in Colorado who are pushing back hard to the best of their ability in this environment. And we will continue to work side by side with them to ensure that, you know, we are providing the care, support, and treatment that people in our community need. And I think it will also lead us as GROC and possibly the Jefferson Council as well to really think about, do we need to shift dollars or rethink that? And also talking at a state level with the AG and the AG's team. We work very closely with our partners in the other regions as well. So these are common issues that we're all tackling together. So, you know, with your support and help and others around the state, I think we have a really good team moving forward to kind of sort this out. It is a tough one.
To add on, Region 8 is Adams County, and they use a lot of Jefferson County services. And so we are trying to brainstorm. I work closely with their program managers to brainstorm a cross-regional collaboration of some kind and what that would look like. Both regions did identify sober living as an imperative issue. And so I am hosting a sober living kind of brainstorming meeting on April 4th. It's completely virtual of like, what would that collaboration look like? What could it look like? Maybe it's joining a more formal organization where you submit an RFA one time, and then you have this kind of open-ended budget that you can bill for scholarships. So you have, again, a working relationship between Region 8 and Region 10. We create a pot of money between the two regions. I did speak a little bit with a provider at Aspen Ridge Recovery. And so we were thinking the same thing, is like, what would that look like for treatment centers? So I'm very interested in having like an ad hoc treatment only kind of meeting of what does that longer term collaboration, what could it look like? Yeah. And then again, what would it look like for treatment and sober living to actually bridge to give a full continuum of care? Yes.
I think one thought that we've had is we'd like to see a higher admin rate. As an impact of the federal funding, a lot of the organizational capacity building, it's not direct support, has been cut. We just lost something from Enterprise yesterday that was all capacity building. That would really help with the hits that we're taking right now, and would also, that we're like 15% and fall in line with the de minimis rate, the federal de minimis rate of indirect costs. So I think that would be something helpful if that's something that's flexible and that you guys can do.
Yeah, so I think you're referencing in the budget template, we have allocated a 10% administrative cost. We automatically calculated that in for you. That's new. We don't have a lot of direction for it. Think of this really as your overhead. Because in the first round, people didn't calculate administrative costs, and then you get into contracting and it's like, oh no, how are we gonna pay for this? So we have to go ask for more money. So anything that you can pull out of the admin, the 10% admin, please do so. You also have the option of like making a line item for salaries in Fringe, not in the 10% admin cost. So if you need to pull something out into an actual line item, you're encouraged to do that. This is also keeping in mind that the GROC is not here to fund your entire organization. It is only intended to fund what is outlined in your application to service Region 10. So again, if you have services in Denver, in Adams, in Jefferson, we don't believe it's our position to fund your administrative costs for services that happen in Denver and Adams County, because that's outside our region. So this is where you would be encouraged to braid or blend funding from the other regional councils for your whole organization. So if you, if you have more questions about that specificity, I'm trying to say, thank you. Please jump on my calendar and so that we can have that conversation and work through maybe again pulling out certain line items or where you can partner with other people. So like peer recovery services, Advocates for Recovery is a funded grantee to provide recovery services like peer education, peer recovery meetings. So if you could lean into them and not create your own line item for that, that would be the most ideal situation.
Okay, so in that example, like leaning into them for, I have peer coaches that need to get their C-car. I reach out to Advocates for Recovery. They have funding from GROC to be able to move them through that training.
Yeah, right. Yeah.
Love that.
I don't know if they specifically have that, but yes, that is in the hypothetical example, yes. I do want to be cognizant of time as we wrap up so that I can give the Jefferson County Task Force their time to talk about their specific work. Is there anything else that you would like to share for the regional council to consider as they're reviewing requests for applications?
So Marty Ferrero. So if I heard this correctly, or correct me if I'm wrong, in terms of the application, in terms of efficacy outcomes, because that's been something outcomes in this field. I mean, it depends on who's measuring what. If
Yeah.
they don't answer the phone, oh, we can
What's
count them.
what year?
Some places have 85, 90%, you know, because that's who they reach. We're the ones then that propose as part of the application, how we're gonna measure this, the measurement-based outcomes.
Yes,
And then you
yes,
get to look at, yeah.
yes. And then if the council does have some questions or concerns about it, they will still be encouraged to fund the idea and let me work with the applicant in contracting to solidify what those measurements actually look like. Yeah, I'm very thankful. I have a lot of trust from the council to do a good job in that area. All right, so I will go ahead and turn it over to Todd and Tina to talk about their specific work in Jefferson County.
Well, we also in Jefferson County have some funds that we have access to. We do have a handout for everybody. And there is a QR code because we're at a spot right now